The 4 causes of constant mucus phlegm in your throat. Constant mucus or phlegm in the throat, a condition known as chronic throat mucus or chronic phlegm, can be a persistent and bothersome issue. It's essential to understand the potential causes and underlying factors behind this condition to effectively manage and alleviate it. In this overview, we'll explore 4 common causes of constant mucus or phlegm in the throat, as well as their symptoms, diagnosis, and treatment options. 1. Respiratory infections. Respiratory infections are a prevalent cause of constant mucus or phlegm in the throat. These infections can be viral or bacterial and typically affect the upper or lower respiratory tract. The irritation and inflammation caused by these infections lead to an increased production of mucus as the body's natural defense mechanism. Symptoms: persistent cough, sore throat, runny or stuffy nose, fatigue, body aches, fever in some cases. Diagnosis: respiratory infections are often diagnosed based on symptoms, physical examination, and sometimes laboratory tests such as throat swabs or blood tests. Chest X-rays may be necessary for lower respiratory infections. Treatment: treatment for respiratory infections may include rest and hydration, over-the-counter cold or flu medications, antibiotics for bacterial infections, antiviral medications for some viral infections. Managing symptoms, such as using humidifiers or saline nasal sprays. 2. Allergies. Overview. Allergies can trigger excessive mucus production in the throat due to the body's immune response to allergens. Common allergens include pollen, dust mites, pet dander, and certain foods. Allergic reactions can lead to postnasal drip, a condition in which excess mucus flows down the throat from the nasal passages. Symptoms: sneezing, itchy or watery eyes, nasal congestion, postnasal drip, throat irritation, cough. Diagnosis: allergies are typically diagnosed through a combination of medical history, physical examination, and allergy testing, which may include skin prick tests or blood tests to identify specific allergens. Treatment: treatment for allergies may involve avoiding allergens, over-the-counter or prescription antihistamines, nasal corticosteroid sprays, allergy shots, immunotherapy, decongestants for short-term relief. 3. Gastroesophageal reflux disease, GERD. GERD is a chronic digestive disorder where stomach acid frequently flows back into the esophagus, causing heartburn. In some cases, acid can reach the throat, leading to irritation, a burning sensation, and increased mucus production. This condition is sometimes referred to as laryngopharyngeal reflux, LPR. Symptoms: heartburn, regurgitation, throat irritation, chronic cough, hoarseness, difficulty swallowing. Diagnosis: GERD and LPR are typically diagnosed based on symptoms and may involve tests like endoscopy, pH monitoring, or esophageal manometry to assess the extent of reflux. Treatment: managing GERD and LPR may include lifestyle changes, example dietary modifications, weight loss. Medications like proton pump inhibitors, PPIs, or H2 receptor blockers. Elevating the head of the bed. Avoiding large meals before bedtime. Surgical intervention, in severe cases. 4. Chronic respiratory conditions. Overview. Chronic respiratory conditions such as chronic bronchitis and chronic obstructive pulmonary disease, COPD, can result in persistent mucus production and cough. These conditions often involve inflammation and narrowing of the airways, leading to increased mucus secretion. Symptoms: chronic cough with mucus, shortness of breath, wheezing, frequent respiratory infections, reduced exercise tolerance. Diagnosis: diagnosing chronic respiratory conditions typically involves a combination of medical history, physical examination, lung function tests, spirometry, and imaging studies such as chest X-rays or CT scans. Treatment: managing chronic respiratory conditions may include bronchodilators to open airways, inhaled corticosteroids to reduce inflammation, oxygen therapy in severe cases, pulmonary rehabilitation programs, smoking cessation for those with COPD caused by smoking. In conclusion, constant mucus or phlegm in the throat can be caused by a range of factors, including respiratory infections, allergies, GERD, and chronic respiratory conditions. Proper diagnosis and treatment are essential to address the underlying cause and provide relief from this persistent symptom. If you or someone you know is experiencing chronic throat mucus or phlegm, consult a healthcare professional for a thorough evaluation and personalized treatment plan tailored to the specific cause. Lifestyle modifications and medication can often help alleviate symptoms and improve quality of life for individuals dealing with this condition.